What is bad behavior and what is behavior due to a condition such as ADHD? Sometimes I hear my young patients saying, I can't do that because I have ADHD. And I don't agree with that. And I think what is really difficult is that parents are really struggling with trying to define what is bad behavior and developmentally appropriate and what is ADHD behavior. And I think sometimes the young people I work with, if they've been given a diagnosis, they're very quick to say it's all because of my ADHD. So I think it's really important to kind of separate those out and try and look for those kind of markers around bad behavior, developmentally appropriate behavior or not, and ADHD behaviors. One thing that I do know is that when children with ADHD have uncomfortable, anxious feelings, for example, they can, instead of sitting with the anxiety and the worry, what they do is become very oppositional and angry. So it's easier to be angry and oppositional than to give in to the worries. And I think what often happens is when you then talk to them, they're very contradictory in what they're saying. So they, for example, say, I wanted to do this, but now I don't want to do it. And parents are often saying, but you said you wanted to do this, and now you're saying you don't want to do it. And I think those contradictions are really important to pick up, because when there's a contradiction, there's a tension in the self. And that tension in the self is an ambivalence of emotional issues. So it's really important, instead of getting stuck in the anger and the oppositional behavior, it's trying to actually get to what is happening. And if you hear a contradiction in your child and in a statement, try and work out what is the emotional issues in that contradiction and that ambivalence, because that is the reason their behavior has just escalated.